And good morning, all participants. Welcome back to the second day of the trainings, the collaborative and development of the health system, how to strengthen the capacity of the public health personnel during the COVID-19 pandemic. And for today, I will talk about the basic knowledge in terms of the collaborative and development of the health system. So for the topic outlined for this this morning, it includes the definition of the health system, the goal of the health system, and the health system frameworks that proposed by the WHO, and also the functional health system. And also, I think that I will talk about how to strengthen the health system and the challenges and opportunities of the health system. And the last one, I will talk about the collaborative health system. First, what is the health system? I think that all of you may already know about the definitions. A health system consists of all organizations, people, and actions that the primary purpose is to promote, restore, and all maintain health. This includes the people, institutions, and resources. They are arranged together in accordance with the established policy to improve the health of the populations while responding to the people legitimate expectations and protects them against the cause of the ill health through a variety of activities. What is the health system goals? I think that the health system goal is to improve the health and health equities in the way that they are responsive, financially fair, and makes the best or most efficient and use of the available resources. And the intermediate goal of the health system is the route from input to the health outcomes is to achieve greater access to and coverage for the effective health interventions without compromising efforts to ensure provider quality and safety. So we not decrease the quality and safety. We think about how the people can get the effective health services. To achieve the health system goal, they have to provide the services, develop health workers and other key resources, mobilize and allocate finances, and ensure health system leadership and governance. The functions were identified in the World Health Report 2000 as a set of the 6 building blocks or essential six essential building blocks. Okay. So this is the figure of the WHO health system framework. The major components consist of the system building blocks and also the overall goals and outcomes. I will talk more about each component of the WHO health system framework. The first one is the system building blocks. It's a good health services. It's referred to the delivered effective, safe, and quality personal and non-personal health interventions or service to those who need them when and where needed with the minimum waste of resources. And second block is a well-performing health workforce. Works in the ways that are responsive, fair, and efficient to achieve the best health outcome. For example, there are sufficient numbers and mix of staff, fairly distributed. They are competent, responsive, and productive. The third box is a well-functioning health information system. So the system had to make sure that the productions, analysis, and dissemination and the use of reliable and timely information on health determinants health system performance and health status. And the first box is a well-functioning health system. So the system has to ensure equitable access to essential medical products, vaccines, and technologies. So you have to make sure that these functioning health systems have the quality, safety, and efficacy and cost effectiveness, and the scientifically sound and cost effective use. Fifth block is a good health financing system. I think that this block is also very important. So you have the system has to raise adequate funds for health in a way that to ensure people can use the service and are protected from financial disruptions or impoverishment associated with having to pay for them. And the last block is the leadership and governance. These involve ensuring strategic policy frameworks exist and are combined with effective oversight, coalition buildings, and the provision of appropriate regulations and incentives, attention to system design, and accountability. Now, I will talk a little bit about some design attributes for each building block that hold true across all systems. The first one is multiple dynamic relationships. The health system is a set of interconnected parts that must function together to be effective. I think that change in one area have impact elsewhere, right? And also improvement in one area cannot be achieved without contribution from the others. So interaction between building blocks is essential for achieving better health outcomes. And the second one is health system strengthening. This term defined as improving these 6 health system building blocks and managing their interactions that achieve more equitable and sustained improvement across the health services and health outcomes. These require both technical and political knowledge and actions. And the other attributes is access and coverage. Since the notion of the improved access and coverage lie at the heart of these health system strengthening strategies. So there had to be some common understanding of this term. So when we talk about the health system, we usually think about the accessibilities and coverage to all people. And progress being made is the key concern of the governments and others who invest in health system. It's hard to tell whether and when the desired improvement in health system performance are being achieved. So we have to have the indicators, or we have to have the convincing indicator that can detect the change. The health system can have the well-functioning. It's respond in a balanced way to a population needs and expectations by improving the health status, not just only the individual, but also the families and communities. Defending the population against the threatening its health and protecting people against the financial consequences of ill health, and providing equitable access to people-centered care. And the last one is make it possible for people to participate in decisions affecting their health and health system. Okay. So this is reflect a well-functioning health system. And how about the health system strengthening? It is the process of the identifying and implementing the changes in the policies and practice in the country health system so that country can respond better to its health and health system challenges. The health system strengthening should have the initiatives and strategies that improve one or more the function of the health system and lead to the better health through improvement in access, coverage, quality, and efficiency. What are the challenges and opportunities of the health system? As the spectrums of the EU health changes, so health system have to respond. Their capacity to do so is influenced by a variety of factors. Some health policy challenges are primarily of the concern to low-income countries, and the impact of the aging populations, the provision of chronic care, or social security reform are no longer the concern of the industrialized country alone. So you cannot just look at just one impact, but you have to look all them together. Right now, you have to think about the COVID-19 situation as well. The threat posed by the new epidemics, as I mentioned, such as I think as in the previous times, avian flus and human pandemic influenza, and right now it's COVID-19 pandemics, require a response from all countries, rich and poor. Okay? And given the size of the global spending on health and concern about the health system performance, the question is, why are not health systems working better? Okay, this is an important question. Now, I will talk a little bit about the other term, is collaborative health system. I think that you all know about the meaning and the definition of the health system, right? They consist of many organizations, people, or action, and they are arranged together in accordance with established policy to improve the health of the population. Why collaborative health system is important? Because they have the powerful change will come from the cooperation of the peoples, organization, and various sectors, which work together into a network. And it provides opportunities for individuals and organizations to exchange information, including recent experience with the people or outside of the organization. And they can build cooperation and work together in a manner that benefits each other. And the major key that allows the organization to operate in harmony is to have a great common goal and understand each other's role and responsibility. So right collaboration is very important in the health system. And what is the collaborations? It involves multiple people interacting to achieve a common goal, right? The other definition, it is a process that involves cooperation, communication, negotiation, trust, respect, and understanding to build a synergistic alliance that maximize the contribution of each participations. Okay, so they have to involve to the cooperation, right, interactions to achieve the common goal. The other definition is collaboration is a process of working together, negotiating agreement, and managing conflict. and both valuing and understanding on another's. It involves working together, share planning over time, functioning cooperatively as colleagues and equal with respect, and a will to find solutions together. What is the collaboration? I think that from the previous definition that I already told all of you, I think that collaboration is an integration of activities and knowledge that require a partnership of shared authority and responsibilities. And what is the collaborative health system? It's a collaboration in healthcare. It's related to collaboration in healthcare. It is a coordinate team activities in which members with various knowledge, skills, and capability work together to conduct a series of tasks for meeting the shared targets. And collaboration occurs when a group of autonomous stakeholders of a problem domain engages in an interactive process using shared rule, norm, or structure to act on issues related to that domain. And collaborative health can address the growing expectations of the healthcare users and current healthcare challenges, an increase in chronic disease and population aging, most of which require greater collaboration among healthcare actors to be properly addressed. The quality of the collaboration that brings together healthcare stakeholders to achieve common goals, improve the objectives, is a key for healthcare improvement. And collaboration may result in optimizing the development of resources, enhancing communication, coordinations, and consequently a better health care performance. The other term that I would like to tell you is the integrations. It looks like the same meaning or it's similar meaning with the collaboration, right? Integration is a concept that used for expanding the relationships among participating units within the community health system. It's aiming for a better efficacy and efficiency of the system. Community health systems, primary health care, and primary health services, and integration. These terms are all related in terms of their value in creating healthcare processes to make the people healthy and healthy society. And the ultimate goal is the community health system. These are the ultimate goal of the community health system. We look for the healthy people and healthy society. Community health system is a Thai health ideology based on the concept of primary health care. And primary health care is defined as a whole of society approach to health and well-being centered on the needs and preferences of individuals, families, and communities. Primary health care provides whole person care for health needs throughout the lifespan, not just only specific one disease. So we look on and throughout of the lifespan of the human. Primary health care ensure people receive comprehensive care, ranging from promotion, prevention to treatment, and rehabilitation and palliative care, as feasible to the people every day. So why primary health care is very important in the health system. Integration in the health system means the harmoniously combining of peoples, groups, organizations, knowledge technologies, and so on, related to health in order to create the cooperations at various levels in managing the health system, leading to the change in lifestyle, behavior, or health practice. So, for the summaries, integration in the health system is emphasized the harmonies among each integrating participant. Right? So we look for the participant of the people, participant of the organization or institutions. I showed this slide for you because I think that some of you may heard from the televisions. Thailand get the sixth best healthcare system in the world. This is the CEO World Magazine ranked from the 89 of the world best healthcare system in the world. Okay. And also Thailand get the second best country at the good recovery index from the COVID-19 pandemic. Okay. I will show you a video clip about the community response to COVID-19 in Thailand. So you will give an idea why we have success in the response to the COVID-19.
I'd like to invite the next speaker, Dr. Anya Pon from Mahidol University, Thailand.
Thank you very much. Could you hear me?
Yes, I hear you very well. Yes.
Okay, thank you. Let me share my slide.
Yes.
So, good afternoon, everyone. Thank you very much for inviting me to this event. It's been very interesting. So, I would like to share the situation from Thailand. So, let me tell you about the profile of Thailand. So, the first case of COVID-19 in Thailand was reported on 13 January 2020. And this is the first confirmed case outside of China. And after that, Thailand has a large cluster of infections related with boxing stadiums in Bangkok, which related around hundreds of cases. And Thai government declared emergency decree on 26 March, which results in a ban of leaving house in the night, and also the school and public facilities and also shops were closed. And also the government set up the Center for COVID-19 Situation Administration or CCSA, and it has a report every day on the public television. The Thailand COVID situation until now, we have 3,147 cases, and yesterday we have 1 new cases, but recently the new cases they were returnees from abroad, and we have 58 days. And so the cases, the highest number of cases is in Bangkok and Phuket and Nonthaburi, which is near Bangkok. And the government decree of emergency, so we cannot have the Songkran holiday or the Water Festival this year. And whoever celebrates this New Year festival will be faced with penalty. So what are the protective factors for Thailand? So we think that maybe warmer weather or the racial differences. We have the culture that prefer not to shake hands or hugging. And also we have very high rate of mask wearing, because if you don't wear mask, you cannot enter a lot of facilities. And also the spirit of cooperation from the public is very high for this pandemic. Also, the government response to this crisis, they let health experts lead. So the messages to the public is very clear, and there are some cooperation between government department and the locals. And also, I would like to highlight the mobilization of healthcare workers here. So the community response to COVID pandemic in Thailand, I would like to highlight the village health volunteers. They have been praised as silent heroes. The village health volunteers are the volunteers which help the health prevention and promotion in Thailand. This system has been established about 30 years before, and now there are around 1 million village health volunteers in Thailand and in every village in Thailand. So in this pandemic, they conduct house-to-house visits and they provide information, strengthen social distance behavior. And if there are new people come to the village, they will search and assess for people at risk. So this is a very strong primary healthcare resource which work very closely with the primary healthcare hospital and also the primary care unit in the sub-district level. So here are the photos of the village health volunteer on duty. This is the training and the house call that they did. As I said before, with 1 million members, they do the check of the households and villages, and also they instruct people with proper knowledge and encourage the social distancing behaviors. Also, I would like to talk about Thai society here. Thai society has been very cooperative in this pandemic. 70% of Thais involving in the social distance measure. And however, people with low income who live in urban area, they cannot practice the social distance very well because they have to go to the fresh market or use the public transportation. And television was still the main media for retrieving information about COVID-19, following by the social media. And as Thailand have very wide financial gap, the local food banks were set up to help people in this situation. I will show the photos later. And also in Thailand, we use Thai Chana mobile phone application to facilitate in disease control tracking. And here are the photos of Thailand. This is the situation in the SkyTrain. Almost everyone wear mask because if they don't wear mask, they cannot enter the transportation. And also, the picture below is the restaurant in Thailand that they do some measure for like these plastic barriers. And also on the right side is the picture of the local food banks. It looks like a household cupboard where people can put the food they would like to share in, and people who need the food can come in and get the food for free. So this has been tested in Bangkok and Rayong, and then after that it become very popular and spread all over the country. And this is a Thai Chana application which the government proposed. So the shops or the facility have to register on the website to receive the QR code and put this QR code in front of the shop. And then if the people come to the shop, they have to check in with this QR code by the application. So they have to check in and check out every time they use the facility. This will provide information to track for the infection. So there are some challenges still left for Thailand. Now we just relax the lockdown, so we are being very cautious about the second wave. And also with the financial crisis, with lots of people unemployed, we are worried about the mental health. And now the hospital is being very crowded again. So I think the telehealth or telemedicine is the must for us to think about. And also we have to find a way, because the school has reopened, so we must find a way how to manage the school system. Thank you.
Okay. After you see the video clip, I think that the one important thing that I would like to show you about the protective factors, right? You will see that the presenter is present about the factor that Thailand or the community in Thailand are success in the control of the COVID-19 pandemics. The first one is the warmer weather. I think that because Thailand is located in the hot area, so I think that why we can stop the pandemic of the COVID-19. And we have the variety of the races, or we have the racial differences. And one thing I think that is the cultural preferences, right? So we do not have the shaking hand or hugging when we get together or something like that. And also the prevalence of the mask wearing. When we compare with the other country, you will see that people in the Thailand, they wear a lot of the mask when they go outside of their house. And spirit of cooperation from the public. So you will see many Thai people are good cooperation to the regulation or the law or something like that. And also the effectiveness of the government's responses to the crisis. So you will see that the government let the health expert lead to control or to measure of the COVID-19 pandemic. And also we have the good cooperations and coordination between the government department, not just only the public health department or health department, it's other departments all over the countries. And also the last one is very important, mobilization of the healthcare workers. You will see, we not just the official public health provider, we also have the village health volunteer. This is very important thing that why Thailand is success in the control of the COVID-19 pandemics. So I think that I would like to show you about this slide and to compare between the conceptual, the framework of the WHO health system and the thing that you get from the video clip. You will see that when we look at the system building blocks, you will see that some of the factors that make the control of the COVID-19 pandemic in Thailand are successful. You will see, for example, mobilization of the healthcare workers. These are related to the medicine, it's the human resources, right? You have the public health personnel that are competent, efficiency, and effective. And also we have the village health volunteer in all areas in the community in Thailand. And also the effectiveness of government responses to crisis is related to the leaderships and governments, right? You will see that the government with the health expert to be a leader, to provide the information about the regulations, how to control the COVID-19 pandemics, right? And also, I think that the financial is very important also. You will see that the government try to provide the masks or the personal protective equipment, not just for the people, but also for the public health personnel. And also the information, you will see that the government is provide the clarities of the communications to avoid the transmission of the COVID-19. So I think that this is the important components that why Thailand has success in the control of the COVID-19 pandemic. Okay. And how about your country? So you may think about in your country, what factors it makes your country recover from COVID-19 pandemics? Based on the WHO health system framework, I think that you may think after finish this session, you can go back and sit back and relax and think about the factor that makes your country recover from the COVID-19 pandemic. Okay. I will show you one more video clip about the village health volunteer during the COVID-19 pandemic.
นางสุรินทร์มากละดีอายุ77ปีอยู่บ้านเลขที่70/1หมู่4ตำบลสารแดงอำเภอเมืองจังหวัดอ่างทองเป็นอสม.มา38ปีป้ารักอสม.มันเป็นจิตอาสาที่ทำแล้วมาก่อนป้าไม่เคยได้ค่าตอบแทนเลยป้าภาคภูมิใจตรงนี้และยิ่งมาตอนนี้ป้ายิ่งภาคภูมิใจมากเลยที่คนทั่วโลกยกย่องอสม.
Okay, you will see that how the functions. I mean, what is the function of the village health volunteers? Why it's very strong. I think health system in Thailand that makes our country succeed in the control of the COVID-19 pandemic. I think that I finish off my lecture or presentation. Before we start Q&A session, I think that I will have a short break, about 10 minutes, and then we will come back for the Q&A session. Thank you very much.
Everybody. I hope you enjoyed Dr. Tani's lecture, and thank you, Assistant Professor Dr. Tani, for providing us with that interesting and useful information. As he mentioned, we will break for 10 minutes before we return. But during the break, I have one request. One of our participants, their username comes up as admin. And we are trying to take attendance for everyone. So if it's possible for admin to send us a private chat or for admin to change their name so that we can see your name and your country, that way we can make sure to mark you as present so that when we pick participants for future Tiger trainings, we can make sure that you are prioritized. So thank you very much. We will see you in about 10 minutes when we will have question and answers. And again, if you think of more questions during the break, just put them into the chat. Thank you.
University Faculty of Nursing's vision is to be a world-class educational and research institution. Our goal is to be rated in the top 100 schools of nursing in QS World University Rankings by 2021. This goal has motivated the faculty to continually improve our operations management by adopting the Thailand Quality Award criteria as a framework for delivering value to all customer groups. As a result of our strong commitment to organizational excellence, we were selected as a 2019 recipient of the Thailand Quality Class Award, which symbolizes world-class excellence. This was the first year our Faculty of Nursing applied, and we are the first ever Faculty of Nursing in Thailand to receive this prestigious honor. The Chiang Mai University Faculty of Nursing has improved all management systems using our core competencies, enhancing competencies through local and international networks and professionalism in organizational administration, teaching, research, and academic services. We have also improved processes within the organization using the standards set by Thailand Quality Award and education criteria for performance excellence as tools. These improvements have allowed us to continuously enhance organizational performance. The Chiang Mai University Faculty of Nursing was founded on August 15, 1972. However, nursing education first began in 1960 before it was an independent Faculty of Nursing. For 60 years, the Chiang Mai University Faculty of Nursing has maintained a consistent focus on developing resources, curricula, research, and innovative approaches to nursing education and leadership. Currently, we offer degree programs in nursing at the baccalaureate, master's, and doctoral levels. We have both a Thai language and an international English language for all programs and are proud to count students from 20 countries around the world among our 13,065 alumni. As the world changes, the Faculty of Nursing realized that we must change how we teach to reach the students of today's world. We have improved our curricula and learning methods in order to encourage our students to be active global citizens who value lifelong learning and contributing to society. A variety of learning methods, including innovations online learning, nursing specialty certificate programs, lifelong education, and national and international short training courses are developed to meet the needs and learning styles of all of our customers. We have also founded a Center for Excellence in Nursing Research, an umbrella organization for 9 research centers led by our expert nursing faculty. These centers aim to drive academic knowledge, research, and innovation in key areas of nursing and academic services for the community. These centers also allow our students to gain valuable first-hand experience participating in research and academic services that helps the community. The 9 centers focus on research that spans the lifespan from pregnancy to end of life and have generated valuable findings that have benefited society, influenced how we teach our students, and generated new knowledge. We have used these findings to change nursing education and academic services locally and internationally. As the Faculty of Nursing continually improves and strives for excellence, our senior leadership team is steadfastly working towards realizing the faculty's vision to be an internationally recognized leader in nursing. Senior leaders set organizational values which all staff members must abide by. Organizational vision, mission, and values are embedded in the leadership system and deployed to all staff members, customers, partners, and the communities served through a variety of communication mechanisms. Senior leaders actively participate in all aspects of the strategic planning process and make decisions using extensive data and information to adapt to rapid global changes. This effective leadership system allowed us to continuously enhance performance, and as a result, our dean and academics are recognized as experts and leaders both nationally and internationally. In the areas of human resource management, we're paying attention to both capacity and capability and creating a healthy workplace environment to be the foundation of career conduciveness. We also pay attention to knowledge management through the knowledge management process for enhancing knowledge sharing to improve the abilities and skills of faculty members and team collaboration. These processes increase the faculty members' loyalty and engagement and improve organizational performance. We are guiding the development of the faculty based on the Thailand Quality Award criteria, which has yielded rewarding results. We pride ourselves on delivering value to customers derived from excellent services and quality products. All of our graduates are able to pass the Thai licensing exam on the first attempt. Employers are extremely satisfied with our graduates in terms of quality, morality, and ethics, and the 21st century skills for global citizens. Our faculty members are increasingly publishing their research in local and international journals in an effort to maximize the reach and impact of their research and findings. Participants in our local and international training courses have a high level of satisfaction with the expertise of their lecturers. The results of our heightened leadership and governance are reflected in the increasing trust of our staff members in senior leaders' ability to achieve their vision through strong organizational leadership and governance. Moving forward, the Chiang Mai University Faculty of Nursing still needs to continually adapt to the rapid changes that can become opportunities and challenges. It will be important to have the engagement of all faculty members and alumni to drive the Chiang Mai University Faculty of Nursing towards achieving its vision of becoming a leading international nursing education institution in education and research.
Hello, everybody. Welcome back. We will now begin the question and answer period. So I am going to share my screen because we have started gathering everyone's questions. We know that the questions are still coming in, and we will add those after we've gone through all of these. I hope this is easy for everyone to read. So we will go through them one by one, and we will let Assistant Professor Dr. Tani begin with Leonardo's question. How can we do that if the corruption came from above, from the health minister, or down there, if one is more corrupt than another?
Can I answer this question? Okay. I think that in Thailand we have the strong, I think that the health system, because we have the hierarchical orders from the, in terms of the, from the top to the down or from to the bottoms. I think that we do not have much problem about this. So I'm not sure I answered this question or not, because your question is how we can do it if the corruption came from above, from the health minister to down, there is one more corrupt to another. Because we work as the team, And also we have the strong system of the healthcare personnel. We have the good communications between each public health personnel. Okay, and I will go to the second questions. Is the renal replacement therapy for the chronic kidney disease patients is not covered by the universal coverage in Thailand. And what is the evidence-based policy behind this decision? I think that this question, Dr. Rangsi may help to answer these questions because she is in this room also. Okay.
Yes, okay, I'm
The
here.
renal replacement therapy, why the universal coverage scheme in Thailand is not provide for the people.
Yes, generally they have the guideline for the renal replacement, but for the chronic kidney disease. Generally, if the patient who got universal coverage, they need to have the standard, and then they need to go to the hospital, and the doctor will refer them to the center for peritoneal hemodialysis. So it means that they have the guideline to refer the patient, but we don't have the universal coverage to cover kidney replacement at this moment. Yeah, but in the future, I'm not sure about that. Yeah.
Coverage and medical care benefits packages, which did quite well with relative low cost. What is the low of nurse in the country healthcare success? I think that when we provide the health services in the community, where the public health personnel work together with the local official personnel, not just only the community hospital only. They work with the local organization, local administration organization, and they can provide some budget to provide the health services in the communities, not just waiting for the budget from the Ministry of Public Health only. So why I think that the role of nurses in the country healthcare success, I think that the nurse and also the other healthcare, public health care provider, they work with the people in the community and other local organizations to improve the health of the people in the community. Okay. And how to participate in the health system strengthening by nurses in Thailand. I think that the nurse should get the education continuously, and they have to provide the training for them to update their knowledge and skill. I think that this is very important, how to strengthen the health system in Thailand. Because right now, not just only the general knowledge, but also in the knowledge related to COVID-19. Okay, we have provide education for them to know about the COVID-19 situation, how to screening, how to protect themselves from this disease, and how to educate the people in the community. Okay, so I think that this is like we provide the health literacy in terms of the COVID-19 for the, not just only for the public health personnel in the community, it's also among the people in the communities. Okay, and how to use strategies power change in the community that is resistant to change. It's very difficult to answer this question. I think that it depends on some areas or some communities. But eventually, I think that all of them agree to do because they can affect not just only themselves, but the people all over the country. I think that is very important to provide the information, to provide communication with the people in the community is very important. It will help to decrease the resistance to change. Okay. And next, what has been the low and effective contribution of Thai Nurses Association in the development and implementation of health policy that improve the preventive health system for the entire population? So this question is about the contribution of Thai Nurse Associations, right? So I think that not just only Thai Nurse Association, is also Thailand Nursing Council also. They provide, I think that they provide the PPE, right? PPE for the nurses and also the nursing students all over the country. Because these people has at the great risk to contact with the patient with the COVID-19. And also they provide, I think that there's some training costs, right? And also, right, also they provide the knowledge for the people in general, the general people also. I think that this. And the next questions, based on Thailand experience, how is the deliveries of palliative care in the community conduct? And who responds for it? Is it the healthcare personnel at the primary care unit or district hospital? I think Dr. Langsia will help me to answer these questions.
Okay, sorry, I can answer this question. Generally, for the palliative care, we working together as a district health system and also continuing care. So I can say that in the primary care unit and also district hospital, we work together to take care of the patient who got the palliative care. At this moment, I can say that some hospital, for example, University Hospital, Prince of Songkla University, they also provide palliative care to the people in the community. Yes, so I can say that all over the country at this moment, we give the palliative care at the primary care unit and also district health hospital.
Next questions. The integrating primary healthcare concepts, especially to the indigenous people, considering that they too have long-standing belief of culture and tradition. Can you share insight how will the integration be like for this population group? I think this is related to the belief of the culture and traditions. I'm not sure about these questions. Healthcare, integrating primary healthcare concept to indigenous peoples. They to have long-standing belief of culture and tradition. How will the integration to be for these populations? Dr. Langsia, can you help me? This question is very difficult to answer.
Yes, I think so. I can say that Thai culture have very different, in particular Buddhist belief and Buddhist. So I think in terms of we integrate in primary healthcare, I can say that in community generally we have the monk, the Buddhist belief that we have the sharing people in the community, right? On Thursday, you can see one of the community who have the collaboration and have the community engagement that they work together, and also they including health belief and also the cultural belief to sharing or kindness people in the community. So I think maybe this maybe is the right answer, right? That talking about the how belief. Mm-hmm.
Okay, the next question, how we can involve veterinarians in the fight against COVID-19. I think that as I show you one video about the how the protective factors that is makes our country to success in the COVID-19 pandemic measures. I think that is because we work or we use the coordination and cooperation between the government department, not just only the public health or health department. We also work with the other department, such as with veterinary department also. So we work together, not just only in the field or in the area of the health. Okay. And next question is how massive movement from community to handling COVID-19. Could you explain how important is community in handling COVID-19? So I think that in the community, the public health providers work with the village health volunteer in providing the screenings, right? The people in the community, especially in the people that they come from outside of the community, they will get the screening for the COVID-19. And also, I think that we also active strategy, have the active strategy to visit the people in the house to help the health care provider to screen the clients in the house. Okay. And I think this one is not the question, right? Thai government can deal with how Thai government and community deal with the COVID with all measurements such as mask, social distance, people in the market, even in the restaurant table chair. I think that we have the strong regulations because we use the emergency decree to control all people in the country to follow the law and regulation at this time. So if you go to the shopping mall or the restaurant, you have to wear the mask. If you don't wear it, you cannot enter to the restaurant or something like that. And also when you go to some places, when you're waiting for the service, you have to sit in and keep the social distance or something like that. If the restaurant or the shop is not following the regulation, they will be closed or something like that. So the regulation is very important at this time. Okay. Given the success story of Thailand in managing the pandemic in both community and national level, what would you think are the strategic area that need further improvement? What do you think, Dr. Langsia? What the factor that make the strategic area that need further improvement to managing the pandemic of the COVID-19? I think that we concerned about the to prevent the second wave of the COVID-19.
Yes, of course.
Because
And
we think that in the first wave, we can success in the control or the managing of the COVID-19 pandemic. But for the second wave, if the people think that it's okay right now, they may follow the law or the regulation or protect themselves, such as wear the face shield or something like, or clean their hand or something like that. So we think that we have to encourage them to continue how to prevent the transmission of this disease. I think this is very important. Not just only the public health personnel, it's also all people in the country.
Yes, I think so.
The next, how long time primary health care prepared this case collaboration so that the local citizens can be involved to manage these pandemics. I think that, as I mentioned earlier, we try to improve the knowledge and the skill of the people. We try to provide the health literacy in terms of the COVID-19 areas to both the general people or the people in the community and also public health personnel or healthcare providers. This is important. Okay. Next, sometimes collaboration is easy to say, but so difficult to practice because of every stakeholders have their ego. How we can solve this problem about ego? What kind of leadership we need to make the collaboration running well? I think that maybe our Thai culture, our background, when we have to face with the serious situation, I think that the ego will be go down, right? We think to everyone have to have, everyone should help each other during the crisis situation. I think that is our culture is very important.
From Philippines.
Is the universal health care in Thailand play a big role in providing assistance to COVID-19 victims? How do you facilitate its mechanisms? I think that not just only the public organization, it's also the private organization. They can provide the screening, provide the treatment based on the UC, universal coverage. If they found the patient have the illness with the COVID-19, the private hospital can treat them, not just only the public hospital. So they work together. Why I think that Thailand is success in the treatment of the COVID-19 patient, not just only the prevention, but also the treatment of the patient as well. Okay. You already give the example of how collaborative health system. Maybe I skip. Okay, you already give the example how collaborative health system work in Thailand, especially in Thai primary healthcare system. So who organize and responsible to create training for the volunteer? I think the majority and the major responsibilities come from the Department of Public Health. They provide training for the village health volunteer, not by the healthcare provider in the local community, in the local hospital, and also in the level of in the district and sub-district hospital. provide the training for the volunteer to become as the village health volunteers. Okay. How do you implement your referral system through service delivery network in addressing COVID-19? I think Dr. Langsiya may help me to answer this question about the referral system.
Generally in Thailand, we have the referral system already. You can call 1669 and then they have the call center to pick up the patient from the community or from the primary care to the tertiary care or secondary care as the patient symptom. But in the COVID situation, once the patient go to the primary care unit or go to the secondary like district hospital, once the doctor detect that they have the risk for COVID-19, and then they will have the center to pick up the patient, go directly to the ward or go directly to the COVID-19 ward. I think we have a little bit different system from before.
Thank you. The next question is how manage the COVID-19 pandemic. I think that some countries they had a real number. I think that in Thailand, one successful factor of the managing the pandemic of the COVID-19 is the clarity of the communication to the public. The number of the people who the new cases, the prevalence of the patient or something like that. So I think that clarity of the communication to the public is very important. What are the incentives for the village health volunteer? They just only get the monthly income from the government, just only 600 baht per month. Okay. And also I think that they can get only healthcare service just the same as the general people using the universal coverage or something like that. Okay. How can we sustainably support the function of the village health volunteer? Okay, I think that incentive is one factor, and also the good relationship with the healthcare provider in the local communities is very important. And also we provide the refreshment course for them to maintain and reskill, upskill of them in terms of the healthcare service to the people in the communities. This is what is the role of volunteer COVID-19 in Thailand? I think that Dr. Langsiya will help me because I think that the day after tomorrow you will see
You can answer
at
that time.
We wait this question, this answer for this question, okay? How to improve the health literacy of community and family in Thailand regarding COVID-19. Okay, I think that right now in the northern area, especially in Chiang Mai province, we have the project that we get from the funding from the Thai Health Promotion Foundations to study about the health literacy among the people in the community. I think right now they are on the process of the study in terms of the health literacy related to COVID-19. Okay. What are the telemedicine platforms used for teleconsultant to minimize exposure to COVID-19 infection and promote physical distancing in Thailand? I think that we use many platforms, okay, to managing the COVID-19 pandemic in Thailand. I think the medical doctor use the Skype, Line, chat or something like that to communicate with the public health provider in the local community. and also to contact
Thai
with
Chana.
the, and we also have the Thai Chana.
Thai Chana, yes.
You already see in the video clip that I show you. Okay, and how collaboration can be effectively promoted, particularly between public and private players. How does private health player contribute in the context of COVID-19 pandemic response? You will see that at the early pandemic of COVID-19 in Thailand, both public and private hospitals, they work as the same function or the same thing. If they found the suspected cases of the COVID-19 infection, they can screening and they can treat or refer them to the center of the treatment of the COVID-19 patient. And the UC can cover it. Even though they go to the private hospital, the universal coverage will pay for the healthcare costs for them, not just only the public hospital. So they work together as a team. Okay. Okay.
Yes.
Next question.
They have more questions coming up at the chat.
How health volunteers were organized. Also, who give them the skill of healthcare. Okay. I think that we have the training course for them, especially for the new village health volunteer. They will get the training from the local hospital and also the district hospitals. I think that I'm not sure about it's about 3 days training course for the new health volunteers. And after that, they will get the refreshment training, about 72 hours training course.
They have some question from Nigeria. He asked about the lockdown in Thailand. If there was, or how did people react to it, and how was it managed? Any palliative to the people?
Lockdown, really
Yes.
the lockdown, right? I think that we give the important success factor to the village health volunteer also. They can go to take care of the patient, right, at the house, and they can communicate. Because when we go to visit the patient at the house, some family, they do not want the public health care provider or the medical doctor to come to see them during the COVID-19 pandemic because they are afraid of to infection of this disease. So they know well about the village health volunteer. They allow them to take care of them during this situation. I think that this is very important why we are successful in the control of the COVID-19 in Thailand.
Yeah. I think they have another question. They're talking about the university. Yes, and where is the question? Sorry. They're talking about the university, that what the university collaboration along the COVID-19.
COVID-19, right? Okay.
Yes.
Because, we have, I think, for example, in the Faculty of Nursing, we have many things to do at this time. So we give the mask and face shield and the PPE to the public health personnel in the local communities because some area they lack of these equipment. And also, what else? We provide the poster, right? And also the video kit
Mhm.
to provide the knowledge to the people and as well as the student. Okay.
Mhm.
And also the university also give the scholarship for the student who come to study in the university and decrease the tuition fee as well. This is the
Yeah.
example that the university and the faculty of nursing is do during these situations.
And also I think the lecturer from our university that have a collaboration with the community, we also provide health services like education, provide course for the people in the community as well. So I think this is the collaboration that we make and we involve to the COVID during the COVID-19 with the community.
Also, they produce the application, right, to record the people when they go outside of the city or the province that have the high risk area, something like that. They have to provide the information on the application, and the people, or I mean the government, can know that which area that they went or something like that. Okay.
They have more questions coming up, ka. Is there a special and official program from the government involving
The government
village health volunteer for COVID-19 prevention? Generally, as far as the Thai government also provide staff for the village health volunteer. Once the people have the self-quarantine at home, and then they will take the bag from the government and give to the people in the community. So I have seen that part in the community. And also, not just only the staff, but they also provide the money in some community to make the mask. So it means that they can hire the people in the community and make the mask and deliver this mask to many people in the community. So this is the example that the government also involved in the village healthcare volunteer activities during the COVID-19 prevention.
Okay, the next question is in
PPE
your
for the
country,
nurse.
right? Even PPE for nurse who will provide care to highly infection disease unit were insufficiency, also inadequate knowledge to community about COVID-19, proper infection prevention and control. So I think that in the high risk area, or in the, for example, in Phuket province, right? Because we have the high numbers of the COVID-19 patients. So the important thing that we have to educate for the healthcare provider how to protect themselves. They provide the PPE equipment, okay, for nurses and other healthcare professionals, while they providing the healthcare to the COVID-19 patient. I think it's very important. But as I already told you, some university give the PPE clothes to the healthcare provider, especially in the rural area, because it's very difficult to find this equipment. So I think that is important. Okay. What are the reward to volunteer in Thailand? As I already mentioned earlier, they just got only the monthly income from the government, just only 600 baht per month. And also they may get the refreshment training, or they can join any activity in the local hospital or something like that. This is the reward or incentive for them. Are there any requirement for village health volunteer? How to ensure they are healthy and do not transmit disease to people they visit? Okay, I think that requirement just only they have to get the training if they want to be a village health volunteer. Okay, because it's a volunteer, it depends on their decisions. And I'm not sure the age of the volunteer. We do not limit it, right?
Yes, no, we don't have.
Limitation of the age of the volunteer. How to ensure they are healthy and do not transmit the disease. As they work with the local healthcare providers, so they have the system how to screen, how to take care of them during they provide the health services to the people in the community during the COVID-19 pandemics. Okay. How do your country train the village health volunteer? Is there training? Yes, we have the training. And also we have the refreshment cost for them as well. What are the indicators to access the healthcare system in low to middle income country? What are the indicators to access? I think that we think about the accessibilities and the coverage, right?
So we have.
So they can get the healthcare service. Everyone can get the healthcare service, not just only the rich people, the poor people as well. Okay, I think that because there are many indicators for the healthcare system.
I think Ajahn Vilawan said yesterday already about the 3 scheme of healthcare system in Thailand. If you work with the government, you can have the government scheme, and then if you work with the factory or with the company,
we use the social security
scheme.
Yes.
And then last, all over the country, we use universal coverage scheme. So we have 3 main schemes. So I think this is the indicator. Yeah.
Okay, next question. The response of the community in the treatment for the COVID-19 pandemics. So as you know, we have both the passive and active strategies, right? If for the active strategy, when we found the patient or suspect cases in the community, they have to give the information for the higher organization, maybe the local and district hospital, sub-district and district hospital, and also the provincial hospital. Okay, so they will have the referral system. If they found the new cases in the community, they will contact each other. At this cause here, the people still don't believe in the disease.
One major point in Thailand, we got the big media that spoke by announced every day from the CCA group spokesman. So I think they make a big wave as a media literacy to the people in the community, also in Thailand. So I think maybe the success of the belief in this disease maybe come from that media as well.
Okay. So as I mentioned earlier, because the clarity of the communication to public is very important.
Yes, yes.
Not just only the new case, it's also the patient who admit in the hospital also how many cases in Thailand. So they provide the real numbers, the real information to the people in the public. Okay. How do you check the quality and also the need of healthcare workers during the pandemic? Okay, the need of the healthcare workers and quality during the pandemic, because I think that each hospital or each healthcare setting, they try to keep their quality and safety to the patients. So we think that this is important for the hospital or the healthcare setting, because they have to make sure that the healthcare worker in the hospital are safe, as well as the client or the people come to see the doctor in the hospital should be safe from the COVID-19 as well. So I think that is very important.
I would like to add the answer, because this topic I will talk on Thursday.
Okay.
Generally, the WHO have the guideline for the workers during the COVID-19. So you can see detail later on Thursday, I think.
Yeah, I think there are a lot of information about the guideline or that the worker have to follow.
Yes.
Okay. Was there lockdown in Thailand? If there was, how did the people react to it?
I
think that
yes,
Dr. Lansi already answered these questions. I think this question we already answered.
Yes.
Okay.
And
okay, that's all. Are there more any questions about these sessions?
oh, they have another question. I think it's very important. Sorry.
Yes, I am sharing my screen. So just one moment. Here we go. Can you see the questions, everybody?
Are there any barriers that hinder between healthcare provider and community to adhere or to follow healthcare policies during the COVID-19 situation in Thailand? The barriers, I think that we have some barriers, just very few. So you will see during the COVID-19 situations, we have the policy of lockdown. Okay, you will see that some people they go outside of their house in the midnight or something like that. Just only few, but maybe that's our culture, the spirit of our Thai people. Okay, they provide a good cooperation to the public. So this is a very good thing for the Thailand to control the COVID-19 pandemic. What are the role of the staff in traditional medicine for the COVID? The traditional medicine in terms of the COVID. I'm not sure about this. During these situations.
If you mean Thai massage, so we closed the shop at that time. They have many phases to reopen.
I think that one thing that I heard from the television about the health, right? To decrease the sign and symptom of COVID-19. They are on the process of studying. They find out the one of the Thai health that to treat the COVID-19 patient or the COVID-19 clients. any financial assistance by government to people who lost their job during lockdown? Yes, because we concern a lot. Because as the policy of the lockdown, they impact of the people in the country, especially in the, I think that in the worker who work in the industry as well as in the informal workers.
Yeah.
They lose their jobs during at this time. So I think that if the workers under the Social Security Fund, they will get the compensation from this scheme. Okay, and for the people under the universal coverage, the people, the Thai government gave the money to the people, especially in the poor people. I think 5,000 baht per person during at the COVID-19 situation. The government paid the money for the people as well. Okay. Okay, and any questions?